In this lesson, we're going to focus on three important special populations in addiction counseling. One is going to be working effectively with LGBTQ clients, understanding the unique needs of older adults, and also substance use disorders, addressing considerations specific to veterans. And each one of these groups is going to be have a tailored approach to really just ensure that we provide respectful, effective, and culturally competent care. So LGBTQ plus stands for lesbian, gay, bisexual, transgender, queer or questioning, and others. And this population faces some really unique stressors. They are discriminated against. There's a stigma. They have minority stress, and that's going to contribute to higher rates of substance use compared to the general population. So providing affirming, inclusive care that respects clients' identities and experiences is going to be essential to building trust and effective treatment. When we work with LGBTQ plus clients, it's going to be crucial to use inclusive language and avoid making assumptions about their gender identity or their sexual orientation. A lot of these people have experienced trauma or chronic stress related to stigma and discrimination. So creating a safe and welcoming environment is going to help reduce those barriers to treatment and promote openness and lead to better outcomes. So some of the best practices are going to be asking the clients their preferred pronouns, what is their preferred identity in a respectful manner, and also understanding that diverse family structures and social supports are going to be important for the client, and linking those clients with the LGBTQ plus community resources. Also recognizing the resilience that a lot of individuals develop in the LGBTQ plus community. That's going to be important because as counselors, we can help the clients build on those strengths as part of their recovery. So switching over to older adults, substance use among older adults is a growing concern with rising rates of alcohol misuse, prescription medication abuse, and opioid use. We have this age-related change like slower metabolism and an increased sensitivity to substances, and that's going to intensify effects and the health risks. So awareness of these factors is going to be key to proper assessment and treatment planning. Older adults often face social isolation and grief from loss of loved ones. They also are going to have a lot of chronic health conditions, and that's going to complicate the substance use treatment. They may be reluctant to disclose anything that they've been using due to the stigma. Also, interactions between substances and prescribed medications need to be carefully monitored to avoid any adverse effects. So effective treatment is going to begin with thorough screening for substance use and co-occurring mental health issues. Our intervention should be adapted to the client's cognitive and physical health status. So engaging family and social supports can really enhance recovery, and collaboration with primary care and also with specialists is going to ensure holistic care. And then we have veterans. Veterans are often going to face elevated risks of substance use disorders, and that's going to be frequently intertwined with trauma and post-traumatic stress disorder. Military culture may foster stigma around seeking mental health care. So understanding these factors is going to be essential for building rapport and delivering effective, sensitive treatment. Some veterans may distrust non-military healthcare providers, and they're going to fear the stigma that could affect their benefits or their career. Many have complex trauma histories, and they're going to face a lot of difficulty just adjusting to civilian life. And all of that's going to hinder engagement in treatment. So addressing those barriers with empathy and knowledge is going to improve the therapeutic relationship. Trauma-informed care is a must when we work with veterans. Validating their military experiences and understanding the culture is going to help to build the trust. So coordinating with Veterans Affairs and veteran-focused organizations is going to enhance resources. Encouraging peer support and community engagement is going to promote long-term recovery and long-term resilience. So in summary, effective addiction counseling for LGBTQ plus clients, older adults, and veterans is going to require specialized knowledge, cultural humility, and tailored interventions that are going to utilize community resources. And also continuing education is going to support the counselor growth and the client success.